I'm Dr. Erik Levy. I'm a licensed psychologist. I've been doing VA exams for probably almost a decade now. I worked with some of the major companies that do them as well as doing them for telemedica. So today's topic appears to be gun ownership and PTSD. And I'm going to be answering some questions about that because I believe this is a pretty misunderstood area. I know I've had a lot of veterans that have come that have delayed filing their claim because they were concerned that they were going to lose their gun rights or their ability to carry guns. So I'll just start by going through some of the questions, and hopefully I'll get to all my information. And if I don't, then I can just talk about the extra information that I have. So the first question would be, it's not necessarily related to the PTSD. PTSD and guns, but I'll answer this one anyway. The first question that pops up on the screen is, can I still get a mental health exam if I'm already rated for a mental health condition? Yeah, I believe because you're going to have a certain percentage when you're rated. So if you're looking for a higher percentage, if you believe you're being underrated, you can always request a mental health exam to see whether you meet the criteria for a higher rating. So it really all depends on sort of your rating and where you think you should be. And if you feel your condition has worsened, you can certainly request a mental health exam. So the first one for guns would be, if my percentage rating for PTSD is higher, do I have a greater chance of losing possession of my guns? Example, does 100% PTSD mean 100% chance of losing guns? So that is a very good question. Regarding that issue, if you have 100% rating, you do have a higher chance of losing possession of your guns. With the lower ratings, there's really no chance of losing possession to carry a gun. But if you have 100% rating, that means you have pretty severe symptoms. And there's also, on the CMP exams, there's also a checkbox whether the veteran is competent to manage his own funds. So if that box is marked that the veteran is not competent to manage their funds, that certainly can affect your ability, because I think that a report gets sent to the FBI, to a government agency, that the person is not competent to do that. Now 100% rating, that's just if we're talking about 100% rating for PTSD. A lot of people have 100% ratings for medical conditions, and that wouldn't necessarily qualify, but 100% rating for PTSD, and also, the person is deemed sort of not competent to manage their funds, that certainly could create a higher chance of somebody losing their rights to carry. Because, with 100% rating, there's really severe symptoms, intermittent inability to do sort of activities of daily living, persistent delusions and hallucinations, grossly inappropriate behavior. So those would all impact that. Would also impact that the person really might not be stable enough or safe enough to manage the ability to carry guns. So that rating is really the only 100% and 100% rating and deemed not competent to manage their own funds would have an impact on your ability to carry. Second question, if suicidal ideation is marked on my psych eval, what does that mean for my future, and how does that affect me? Suicidal ideation usually is linked to a higher rating, 70% rating, deficiencies in most areas. But, a lot of veterans with PTSD or depression have suicidal ideation. That's a very common thing. So that really wouldn't have much of an impact on your future. It wouldn't have an impact on your rating. It wouldn't have an impact on your future. Now, if you were experiencing really significant suicidal ideation, and you were in imminent danger of hurting yourself, or of hurting yourself, that might have an impact because, if you say you're in imminent danger of hurting yourself, it makes the psychologist or the mental health provider have to report that. That's the only time we can sort of go out of confidentiality. So we would have to report that to somebody if the person was in imminent danger, or call the police, and that could result in a hospitalization. So, those would sort of be the impacts of that. I mean, if you just have suicidal ideation that sort of comes and goes, really no intent or plan, then it wouldn't really have that much of an impact. Serious suicidal ideation, consistent suicidal ideation with plans and intents, and also having access to firearms. While it wouldn't necessarily mean the government could take away your guns, it would be sort of, I've had a lot of veterans, where their wives have taken away the guns, or a family member has taken away their guns because they felt like they were a danger to themselves or to other people. So that's something to think about. Regular suicidal ideation comes and goes, and that's not too much of a big deal. Will my PTSD rating affect a family member's right to carry? I believe there's no correlation between those two things. Each person has their own individual rights, so there wouldn't be any impact with that. Are the laws surrounding PTSD and gun ownership rights dependent on the individual states? No, I don't believe they are. It sort of goes back to what we were talking about in the beginning. If a person has PTSD, regardless of the state they're in, it doesn't affect their ability to own a gun, unless, of course, they're at that 100% level and they're deemed not competent to manage funds. I was going to say something else about that too. The law surrounding PTSD and gun ownership rights dependent on the individual state. Yeah, what I was going to say is, I've been doing these exams for years, and the fact is, I've seen tons of police officers, law enforcement officers, correctional officers, security officers, people that carry guns on a regular basis, and they're rated for PTSD. So some of them have fairly significant ratings, but they can manage the PTSD on the job. They can deal with the issues. But, law enforcement officers, a fair amount of them are veterans, and a good proportion of them, have PTSD. And, in my mind, a lot of times I can make them better law enforcement officers because of the stuff they've seen and their hypervigilance and, their watchfulness. So, and I've also had veterans who have wanted to pursue careers in law enforcement that have held off on the rating because they've been scared about that. But the fact is, like I said, people that are rated for PTSD, veterans that are rated for PTSD, are in all sorts of positions where they can carry guns. Again, the question is, how does a PTSD rating affect my ability to purchase guns? Again, that would go back to the 100%. If you have 100% rating and you've been 100% rating for the PTSD, just for the PTSD, and you've been deemed not competent by the VA to manage your funds based on a C&P exam or for whatever reason, again, that report goes to a government agency. So that would affect your ability to purchase guns. I believe I'm not an expert in gun ownership and how to go about getting guns, but I believe that would affect your ability to purchase guns. You would probably come up on some sort of list for that, but that's only at the 100% level. During the evaluation, I told my provider that I had certain symptoms that weren't marked on the final document. Why is that, and how do providers determine qualifications for certain conditions? That's a hard question. I mear can be a lot of different reasons based on how the provider is thinking. If we go to sort of an extreme example, let's say a veteran says that they're having persistent auditory and visual hallucinations, and they're seeing things and they're hearing things and they're impacting their life in all sorts of bad ways. That qualified persistent auditory, persistent delusions and hallucinations falls under the 100% rating. But at the same time, if the veteran has been working, full time and hasn't really had any issues at work, hasn't been written up for things, hasn't had problems dealing with other people, generally gets their assignments done on time, then it's really hard to reconcile persistent delusions and hallucinations and 100% rating with somebody who is doing fine at work. I mean, that's most likely not going to fly with the VA. So, those things have to be weighed. Those things have to be weighed, intermittent ability to, perform tasks of daily living. But again, they're working on their job. They're not getting into any trouble. They're doing well. They have meaningful relationships. A provider can't really mark those down if the full, the full picture has to be taken into account. Just because the veteran says that, if those things jive, I mean, if the veteran's, been out of work, been written up numerous times, rarely leaves the house because of hallucinations, then that's one thing. But if those things don't jive, then a lot of times the provider's not going to put it in there because, it's not going to fly. So, everything sort of has to come together based on the symptoms. So that's some of the reasons. But, the other answer is, you can always talk to the provider, if you get it through a private exam, and they can probably tell you the reason, or somebody can sort of tell you the reason. But most likely that would be the reason, unless the provider just, they just forgot to include that. Next question is, I'm currently rated for 50% for PTSD. I feel like my conditions are getting worse. Should I get a new evaluation done to submit for an increase? Yeah, I mean, if a person feels like if they're rated 50% and they feel like their symptoms are getting worse, then they should certainly get a new evaluation, especially if the issue, especially if the problems are causing more issues at work. That's a big thing for, when we're doing these evaluations, that's a big thing that we look at, is how the person is functioning at work. Has the person been written up? Have the PTSD symptoms increased where they can't get along with their managers, their bosses? Have they got write-ups? Have they gotten talked to? Because they just can't get along, because they can't finish tasks, because they're not showing up for work. So, at 50%, you're sort of in between that. The problems, you might have some difficulty with your reliability and getting things done. But, the next step is, that 70% where you've been written up for stuff, or you're having real problems with your anger and irritability. You're taking it out on other people. You may be getting into fights. You're really arguing with your wife. You're having trouble getting along with your kids. You don't have any friends anymore because you're so irritable, or you don't want to leave the house. So those would be some of the issues that you would want to take into account. But if those, if you were 50% and some of those issues you felt like were really increasing and impacting other areas of your life, then yeah, you should submit a new evaluation. You should submit for an increase. Do other mental health conditions like SSD affect gun ownership? Really, I don't believe so. I mean, somatic symptom disorder is basically, you're going to have depression, worry, anxiety related to your physical disabilities. So it would be pretty rare for me to see somebody that was 100% just for the SSD. I mean, the person could be 100% for their medical conditions, but again, that wouldn't affect the PTSD. So again, it wouldn't. I doubt that it would affect gun. I doubt that mental health condition would affect gun ownership. Now, other mental health conditions like a major depressive disorder, bipolar disorder. If somebody was extremely depressed, extremely impulsive, and again, those conditions warranted that 100% rating. I mean, if somebody was so depressed that they couldn't take care of themselves, they were a constant threat of suicide, they couldn't manage their finances, those issues could certainly have an impact on on gun ownership, because then you'd be more, you could qualify 100% and possibly be deemed not competent to manage your funds, in which case the government agency would have that information. Okay. Let me look at my little list here. So I was going to look at my sort of list of things that I want to talk about. So really, the federal law prohibits firearms, people from possessing firearms. That include, the people that can't have firearms are felons, fugitives, persons addicted to controlled substances, undocumented interests, immigrants, people dishonorably discharged from the armed forces, persons who have renounced their U.S. citizenship, subjects of a qualifying domestic protection order if there's domestic violence involved, persons convicted of domestic violence, and persons who have been adjudicated by a court of law as mentally defective or who have been involuntarily committed to a mental health institution. So, so again, that points towards that 100% rating, or somebody who's extremely suicidal, or somebody who's a documented danger to themselves or others. That would have an impact on your ability to purchase firearms. Let me just go through here. Yeah, I mean, again, there's a lot of stigma around that. I mean, as we all know, the VA has different ratings. So for PTSD, so it's not a black or white issue, and I think sometimes people think that way. People that don't understand the PTSD, people that don't understand veterans, or people that just haven't been involved with that. People with 70% ratings are generally doing, they're not doing okay, but a lot of times they're working, they're maintaining family and home life. So, I think in some people's minds it gets all confused. It's either, if you have PTSD, you're somehow, and I know veterans have that fear. If I tell somebody I have PTSD, how are they going to look at me? They're going to think, that I'm a danger to other people, that I'm just going to end up, going off and shooting everybody. And obviously that's not true. So, we know that, you can have PTSD ratings for 0, 10, 30, 50, or 70%. And up until that point, most people they're not, again, like I said, they're not doing great, but, they're doing okay and they're functioning. It's at that 100% rating that we really, that really issues start to impact possibility of gun ownership and other things. Let's see. I believe that's everything. I don't really think I have anything else to say, if there's no other questions. Oh, another question. Is it important for a veteran to be honest? During the CMP exam, it's very important for the veteran to be honest. I can't tell you how many veterans I've seen that have actually minimized their symptoms. And I know in the military, y'all are told, to just bear with it, to just push through it. Don't admit that you have any weaknesses. And it's hard. It's hard for people to talk, people that have served their country, that have seen stuff that, none of us would ever see. It's hard to talk about the difficulties that you're having and how it's impacting you. But yeah, as what I tell veterans, the CMP exam is the most important place to be honest, because if you're not honest, you're not going to get the proper rating. And you might not even get a PTSD rating. I mean, I've seen some veterans that have clearly had PTSD and have had PTSD for years that minimized, their first CMP exam and either don't have a rating or are underrated or have some, just basic unspecified anxiety disorder rating because they didn't want to let the provider know how difficult their lives have become. So, yeah, I mean, it's important to be honest. It's important not to sort of, it's also important not to make your symptoms worse than they are, obviously, but it's important to be honest and tell the person how the symptoms are affecting you in all areas. Is there a difference between a psych eval with a private provider like telemedic and a C&P exam? There is a difference. C&P exams are basically done through different companies. The VA contracts with different companies to do the formal C&P exams, and that would be LHI, VES, or QTC. So those would be really formal C&P exams where you would get a formal diagnosis and a rating, and it would go directly to the VA. Now, a psych eval with a private provider like Telemedica, those are in the same format as a C&P exam. And many times the VA will accept those. Will accept those from a private provider in determining whether the person has a rating, especially if there's enough supporting evidence, to document, let's say the person's applying for PTSD. Let's say the person's applying for PTSD. They've been to the VA. They have a diagnosis of PTSD, might have a combat infantry badge, Iraq campaign medal, Afghanistan campaign medal. So they haven't had a formal C&P exam, but they're coming to Telemedica for a private exam. So there's a lot of supporting evidence, to show that that person has PTSD and that it's due to their deployments. So many times the VA will accept that, and they'll accept other things if there's a lot of evidence. Now, me also doing C&P exams, sometimes the VA will, even with the private exam through Telemedica, the VA will still request a C&P exam just to confirm, I believe, that. So you might have to do the formal C&P exam as well. But, if I'm doing a formal C&P exam and I see exam from a private provider that's in the records or that the veteran brings, that's that's supporting evidence in terms of what I'm going to diagnose. So even if the private provider exam doesn't necessarily get you a rating right there, that's evidence down the line if you get a C&P exam to show the provider that's doing the C&P exam, because that's definitely supporting evidence in terms of your claim. Hope that answered the question. Doesn't matter if the psych eval is done in person or over telehealth. I believe at this point, I'm not an expert in that question. I believe at this point it doesn't matter. The VA has approved telehealth evaluations. So I think as long as you can see the person, then it's fine. What is a psych eval like? I can tell you, I can't speak for other people. I can tell you what mine is like. A person's going to be coming in and, we're going to get some background information from the forms that you filled out, especially if it's through Telemedica. So I'm going to know, whether you're coming in looking for PTSD. I'm going to know whether you're service connected, whether it's a first time claim because I've looked at the records. I'm going to know whether you have medical conditions, whether you might be applying for depression and anxiety secondary to chronic pain and limitations from your medical conditions. So I'm going to have that information beforehand. I never go into an exam without having that information. So my questions are basically going to be geared towards that. Let's say you're coming in for PTSD. First going to look and see whether there's a stressor that is sufficient to support PTSD, maybe a combat-related stressor or witnessing something traumatic in the military sexual trauma, something like that. So if the stressor's there, then we're going to go through the symptoms. I'm going to go through each of the symptoms. Going to ask how your sleep is, whether you have problems with irritability, whether you still think about the incident, all the symptoms of PTSD, whether you're hypervigilant, and how those symptoms affect you. So I'm going to ask about those symptoms, whether you have them, and I'm going to ask how they affect you. And then I'm going to talk briefly about your background, because that's not as you're about your childhood. It's not as important. But then I'm going to go into what your life is like now. If you're married, if you're not married, what are your social relationships like now? Have you been divorced? Can't maintain a relationship? Trouble with your children? Irritability. So I'm going to be looking for sort of those things and asking questions about that. And then, I'm going to really focus on your occupational, what your job is like now, whether you've been written up, how's it going, what kind of career do you have, whether you've been fired from jobs, whether you've had difficulty maintaining employment, all those things. So the main things that I'm going to if it was me, I'm going to focus on all your symptoms. What symptoms you have, do they support the diagnosis that we're looking at, and how severe are they, and how that has affected your personal life, your social life, and your occupational functioning. So I'm going to ask questions that are sort of geared directly towards that. Can my spouse sit on my psych eval, and should I bring notes so I don't forget everything? Yeah, I find it important. A spouse can certainly sit in on a psych eval. A lot of times they can provide background, more information. A lot of times, again, I said sometimes the veterans minimize their difficulties, and a spouse can really talk more about it or substantiate it more. So yeah, I would recommend that if a spouse wants to sit in, they should sit in. And bringing notes, yes. I know that I have difficulty remembering things, so I assume you all have difficulty remembering things. So yeah, I think you should bring notes. In fact, what I do during exams is I usually go through my list of things, because I know what the symptoms are for all the conditions. I've been doing this for so long. So I'm going to go down my regular list, and most of the time we're going to hit like 90 to 95% of the stuff of the symptoms that are correct. But after that, if the veteran has notes, I'll always ask the veteran to review the notes and say, did we forget anything? And, a lot of times there's a few things that, we didn't cover. So it's very important to have notes. Of course, you can also review the exam afterwards when you get it. But, especially if you go to a formal CNP exam, like I was talking before with one of the 3 companies, it's important to bring notes, because you're not going to have, once that exam is over, you are not going to have any opportunity to talk to the examiner or to make any changes to the exam. So if you go to a formal CNP exam, you want to make sure you know all your symptoms. You don't want to be vague. You don't want to be going off on tangents. You want to have all those symptoms and make sure that examiner has all those symptoms. So it's very important to bring notes for those. Is there a difference between PTSD and SSD? Yeah, they're not even really related to each other at all. PTSD is basically, post-traumatic stress disorder is basically a mental health issue due to, a traumatic experience you went through. You witnessed somebody else go through sexual trauma, basically like that. So somatic symptom disorder is really secondary to any medical conditions that you have. Service-connected medical conditions. So, if you have service-connected medical, if you have chronic pain from, lumbosacral strain or knee conditions or neck conditions, and you find yourself, those conditions that are constantly on your mind, you're worrying about them, you're thinking about them all the time, you're worried that they're going to get worse, they're causing you depression, you can't do the things you used to do. That falls more under somatic symptom disorder. And there's a number of diagnoses a person can use, mental health diagnoses a person can use, to get a mental health condition secondary to the medical conditions or chronic pain. Somatic symptom disorder is just one of them. But yeah, it's basically the sort of depression and anxiety and worry secondary to your chronic pain and limitations and the difficulties your medical conditions have caused. What records are best to have in my folder before an evaluation? Oh, that's an excellent question. Obviously the DD-214, especially if you're applying for PTSD and you have documentation that you have an Iraq campaign medal, you have an Afghanistan campaign medal, you have a combat infantry badge, that you served in support, that you served in a designated imminent danger pay area. So if you're looking for a PTSD rating, and you have those things, that's very important. The second thing, obviously, rated disabilities. If you already have service-connected conditions, the examiner wants to know what disabilities you have already. So, medical and mental health. So that's the second important thing. A third important thing would be your mental health records, especially if they're from the VA, especially if you've been diagnosed with, depression. You have documentation of chronic pain. You've been diagnosed with PTSD. So because those are all, if this is a first-time claim and you've been diagnosed with PTSD already by somebody in the VA, or you've been diagnosed with depression due to medical condition, secondary to chronic pain, those are hugely important in terms of making that nexus statement, the nexus statement that connects your condition now to your service-connected medical conditions or your time in the military. That's extremely important to have. Extremely important. Anything that ties it together is extremely important. So those would be important. And if you have medical records that say you've been diagnosed with a mental health condition in the military, then you're talking really good. Then that's awesome. If you have those records, let's say you're applying for depression now, you've been diagnosed with depression in the military, you're in good shape. If you haven't been diagnosed with depression in the military, or you have no record of mental health counseling, if on your report of medical history you document that you might have nervous trouble or a sleep disturbance or anything under mental health, that's also important too, because that ties, even though you haven't had mental health treatment in the military, that still ties your condition back to the military. So those are, and also a statement in support of claims. If you have any buddy letters or family letters that, correspond that, oh, this person's different from now than when they were before the military, those are all important. But really the main things, the DD-214, rated disabilities, any documentation of mental health conditions from the VA or while you were in the military are the most important things. Can you have PTSD and somatic symptom disorder diagnosis, or would that be pyramiding? No, of course you, I'm sorry, let me say that more clearly. Can you have PTSD and a somatic symptom disorder diagnosis, or would that be pyramiding? No, of course you can have that. A lot of times I will diagnose PTSD as well as a secondary depressive disorder due to the PTSD, because having chronic PTSD symptoms affects your life, so you can have a secondary depression because of that. But then you can certainly have another medical condition, another mental health condition secondary to your service-connected medical diagnoses. So yeah, that's certainly clear. Sometimes it can be a somatic symptom disorder. Sometimes I'll diagnose something called an adjustment disorder with depression and anxiety. That's basically depression and anxiety due to adjustment issues related to your service-connected medical conditions. It's just another way of saying somatic symptom disorder. But yeah, because those are two separate things. The depression and anxiety was secondary and directly due to the chronic pain and limitations and worry because you can't do the things you normally used to do because of the pain. And the PTSD and depression are due to that stressor that you experienced. So no, it's certainly possible to do that. Is a traumatic statement helpful so I don't have to tell you every traumatic event? Honestly, I don't want to hear every traumatic event. Because I know it affects you, and it affects me, and it's difficult to talk about. So yes, having the trauma state, at least for me, my goal is to cause the veterans the least amount of harm and pain as possible during these examinations. If the trauma statement is there, then we can just talk about it briefly, and I can use the trauma statement as a stressor and support. So yeah, that makes it a lot easier for everybody. Okay, I think that's probably it. Hopefully, covered all the questions, and I did not ramble too much. But thank you very much. I appreciate you guys. I appreciate the veterans. I appreciate everybody working with the veterans, and I wish you all the best. Thank you.